Congratulations on welcoming your little bundle of joy into the world. This is a momentous occasion, filled with love, hope, and dreams for the future. Your life is about to change in the most beautiful way. Bringing a newborn home is an incredibly special and life-changing experience. It's a time of new beginnings, where every moment is a first. The first car ride, the first time stepping into your home as a family, and the first night together. As you embark on this extraordinary journey of parenthood, it's natural to feel a mix of emotions, excitement, joy, and perhaps a touch of overwhelm. These feelings are all part of the incredible adventure you're about to undertake. Rest assured, you've got this. Every parent starts somewhere, and with each passing day, you'll grow more confident in your abilities. Caring for a newborn can feel like uncharted territory at times, but with a little guidance and a lot of love, you'll navigate these early days with confidence. Each task, from changing diapers to feeding, will become second nature with practice. This comprehensive guide will equip you with the essential knowledge and practical tips you need to provide your little one with the best possible start in life. You'll find advice on everything from sleep schedules to developmental milestones. From diapering and feeding, which are the basics of newborn care, to bathing and soothing, which help keep your baby clean and comfortable, we'll cover it all in a clear and concise manner. Our goal is to make sure you feel prepared and confident in your new role. Remember, every baby is unique, and what works for one may not work for another. It's important to be flexible and open to trying different approaches. Trust your instincts, be patient with yourself and your baby, and don't hesitate to seek support when needed. Whether it's from family, friends, or healthcare professionals, help is always available. As you embark on this incredible adventure, embrace the joys and challenges that come with parenthood. Each moment, whether joyful or challenging, is a step in building a strong, loving relationship with your child. The bond you form with your newborn during these precious early months will last a lifetime. These are the moments that will shape your child's future and create lasting memories for your family. Let's dive in and empower you with the knowledge and confidence to nurture your little one with love and care. Together, we'll explore the wonderful world of parenthood and ensure you're ready for every step of this amazing journey. Diapering is one of the most fundamental aspects of newborn care. It's a task that every new parent must master, and while it may seem overwhelming at first, it quickly becomes second nature with a bit of practice and patience. While it may seem daunting at first, especially when you're faced with a squirming baby and a messy diaper, rest assured that you will get the hang of it. With a little practice, you'll become a diapering pro in no time. Confidence comes with experience, and soon enough you'll be able to change diapers quickly and efficiently, even in the middle of the night. Here's a step-by-step guide to make the process smooth and comfortable for both you and your baby. Following these steps will help ensure that diaper changes are as stress-free as possible. First, gather all the necessary supplies. You'll need a changing mat or a clean towel to provide a soft, clean surface for your baby. Make sure you have diapers that are appropriately sized for your baby. Diapers that are too small can cause discomfort, while those that are too large may lead to leaks. Wipes are essential for cleaning your baby's bottom. Opt for alcohol-free and fragrance-free wipes to avoid irritating your baby's sensitive skin. Diaper rash cream or ointment can be a lifesaver if your baby develops a rash. It's always good to have some on hand, even if you don't use it every time. A small container of warm water and a washcloth can be used as an alternative to wipes, especially if your baby's skin is particularly sensitive. Before you begin, gather all your supplies and place them within easy reach. This will make the process smoother and prevent you from having to leave your baby unattended. Choose a safe and comfortable changing area, such as a changing table, floor mat, or even your bed. Ensure that the surface is clean and that you have everything you need within arm's reach. Always keep one hand on your baby during diaper changes to ensure their safety. Babies can be surprisingly wiggly, and it's important to prevent any falls. Lay your baby down on the changing mat or towel, making sure they are comfortable and secure. Gently remove their pants or any clothing that may interfere with the diaper change. It's often easiest to dress your baby in clothing that can be easily removed, such as onesies with snaps. If using a disposable diaper, unfold it and position the back half, with the tabs, under your baby's bottom. This will make it easier to secure the diaper once you're done cleaning. Using a clean wipe, gently clean your baby's diaper area from front to back, ensuring you reach all the creases. This helps to remove any residue and prevent infections. For baby girls, always wipe from front to back to prevent urinary tract infections. This simple step can make a big difference in keeping your baby healthy. If you prefer, you can use a soft washcloth dipped in warm water for cleaning. This can be gentler on your baby's skin and is a good option if they have any irritation. Once you've thoroughly cleaned your baby's bottom, pat the area dry with a clean cloth or allow it to air dry for a few moments. This helps to prevent diaper rash by ensuring the skin is completely dry before putting on a new diaper. If your baby has a diaper rash, apply a thin layer of diaper rash cream or ointment to protect their delicate skin. This creates a barrier that helps to heal and prevent further irritation. Now, lift your baby's legs gently by the ankles and slide the front half of the diaper up between their legs. Be gentle to avoid causing any discomfort. Make sure the diaper fits snugly around their waist, but not too tight. A good fit will prevent leaks and keep your baby comfortable. Fasten the tabs on each side of the diaper to secure it in place. Check that the diaper is evenly positioned and that the tabs are secure but not too tight. If using a disposable diaper, fold it neatly and secure it with the adhesive tabs. This helps to contain any mess and makes disposal easier. Dispose of the used diaper properly in a diaper pail or trash can. Make sure the diaper pail is lined with a bag to make disposal more convenient. Always wash your hands thoroughly with soap and water after each diaper change to prevent the spread of germs. Good hygiene is crucial for keeping both you and your baby healthy. Newborn babies poop a lot. Be prepared for frequent diaper changes, especially in the early weeks. It's not uncommon to change diapers 10 to 12 times a day. If your baby has sensitive skin, consider using cloth diapers or hypoallergenic disposable diapers. These options can be gentler on your baby's skin and reduce the risk of irritation. To prevent diaper rash, change your baby's diaper frequently and allow their skin to air dry whenever possible. This helps to keep the skin dry and reduces the risk of irritation. If you notice any signs of diaper rash, such as redness, irritation, or bumps, apply a diaper rash cream or ointment as directed by your pediatrician. Early treatment can help to prevent the rash from getting worse. Diaper changes are a great opportunity for bonding with your baby. Talk to them, sing to them, or make eye contact to foster a loving connection. This can make the experience more enjoyable for both of you and help to strengthen your bond. Keeping your diapering area organized can make a big difference. Have a designated spot for all your supplies so you can easily find what you need. When you're on the go, make sure your diaper bag is well stocked with all the essentials. Include extra diapers, wipes, a changing mat, and a change of clothes for your baby. Regularly check your baby's diaper for wetness or soiling. A quick check can help you stay on top of diaper changes and keep your baby comfortable. A good diaper pail can help to contain odors and make diaper disposal more convenient. Look for one with a secure lid and a liner that's easy to change. If you're not near a sink, use hand sanitizer after changing your baby's diaper. It's a good alternative when soap and water aren't available. Remember, diaper changes are a time to connect with your baby. Smile, talk, and enjoy these moments together. They grow up fast, and these small routines are part of the precious memories you'll cherish. After a successful diaper change, your baby will be clean, comfortable, and ready for their next adventure, whether it's playtime, feeding, or a peaceful nap. Keeping an eye on your baby's comfort and hygiene is an important part of parenting. With these tips, you'll be well equipped to handle diaper changes with confidence and care. Happy diapering, and enjoy every moment with your little one. Breastfeeding is a natural and beautiful way to nourish your newborn. It is a unique bonding experience that fosters a deep connection between mother and child. It provides them with essential nutrients and antibodies, which are vital for their growth and immune system development. While it's a natural process, it can take time and practice for both you and your baby to get the hang of it. Patience and persistence are key during this learning phase. The earlier you begin breastfeeding after birth, the better. Initiating breastfeeding within the first hour of birth can significantly enhance the chances of successful breastfeeding. Colostrum, the first milk your breasts produce, is packed with antibodies and nutrients that are crucial for your baby's health. This thick, yellowish milk acts as your baby's first vaccine, providing protection against infections. Hold your baby skin to skin as soon as possible after delivery, as this encourages their natural feeding instincts. Skin-to-skin contact also helps regulate your baby's body temperature and heart rate. A good latch is essential for comfortable and effective breastfeeding. Ensuring a proper latch can prevent common issues such as sore nipples and inadequate milk transfer. Support your breast with one hand and use the other hand to guide your baby's mouth to your nipple. This technique can help your baby latch on more easily and comfortably. Their mouth should cover a large portion of your areola, not just the nipple. This ensures that your baby is effectively drawing milk and not just sucking on the nipple. Experiment with different breastfeeding positions to find one that is comfortable for both you and your baby. Each mother and baby pair is unique, and what works for one may not work for another. Some popular positions include the cradle hold, cross cradle hold, football hold, and side lying position. Each position offers different benefits and can be more comfortable depending on your situation. Use pillows for support and ensure your baby's head and neck are well supported. Proper support can make breastfeeding more comfortable and reduce strain on your back and arms. Newborns have small stomachs and need to feed frequently. It's normal for them to want to nurse every 2 to 3 hours, or even more often during growth spurts. Look for hunger cues, such as rooting, sucking on their hands, and making smacking noises. Recognizing these early signs can help you feed your baby before they become too upset. Feed your baby on demand whenever they show signs of hunger, rather than on a strict schedule. This responsive feeding approach helps ensure your baby gets enough milk and supports their natural growth patterns. If you experience any pain or discomfort while breastfeeding, consult with a lactation consultant or your healthcare provider. They can offer guidance and support to address any issues you may encounter. Stay hydrated by drinking plenty of water throughout the day. Breastfeeding can make you feel thirsty, so keep a water bottle nearby during nursing sessions. Avoid smoking and consuming alcohol while breastfeeding, as these substances can be harmful to your baby. If you need help quitting smoking or reducing alcohol intake, seek support from your healthcare provider. If you need to supplement with formula for any reason, talk to your pediatrician about the best options for your baby. They can help you choose a formula that complements breastfeeding and meets your baby's nutritional needs. Remember, breastfeeding is a learning curve. Be patient with yourself and your baby, and don't hesitate to seek support from lactation consultants or other breastfeeding mothers. Joining a breastfeeding support group can provide encouragement and practical advice from those who have been through similar experiences.